What is a treatment plan?
You want us to use the chat box, Kieran, or
you can go over the mic. That's fine.
Yeah, look, I think treatment plan is plan of action for the client that guides your treatment, gives them a reason to come back to treatment, shows them what you're going to do if what you're currently on isn't working. So they're sort of my key ones.
Pretty good answer. Anyone want to disagree with Scott? We've got an answer in the chat here. Strategic guide for patient and therapist. Yeah. Yeah, someone said to me yesterday, like someone from overseas where I was talking about this treatment planning stuff, they said it's a clear, concise and confident way. A clear, concise and confident way to deliver your assessment and treatment findings, which I thought was quite nice. A communication method. Yeah, which Abby said, which is true. You know, if you want a more formal answer, you can look on the website that I've got, globalspecialistphysio.com/treatment plan. I've got like a bit more of a blurb on it there, and there's even like a free. Say that again, Kieran. globalspecialistphysio.com/treatment plan. I've got basically a more formal way of articulating it, there it is in larger text. But I've got a free treatment plan that you can download. Mine's maybe a little too complex. Like you could make it even more simple than that. But that would be some of the key things that we're going to cover today. Each section we're going to cover in detail. And so what is it? A treatment plan really is a simple way of summarizing your assessment, treatment, and response to treatment findings to the patient, to plan where they're going to go. And what Scott said, I think, is quite important. Even if physio doesn't work, we call them exit points. Like, when is enough enough? At what point are you going to say, well, look, we've done physio and it's not helping? And I think you've got to always have those options for patients, and that can be really useful. Now, here, just put up this picture here. You might think that that's Justin Timberlake there on the left, but that's actually me. About 15 or 20 years ago. No, about 17 years ago. The chat box is firing up. That is not a perm. That is my hair, if left unkempt, can go a bit wild. Okay, it's not a perm, all right, everybody. That is a legitimate, curly, luscious head of hair, which is slightly thinning. As you can see there, age has not been kind. It's bring back the perm. Why is it this? I'm getting more response from this than anything talking about evidence. So yeah, when I first graduated, I looked a bit like that, young, bright-eyed and young-faced, bright-eyed and bushy-tailed, bushy-haired. But as so when I first graduated, I had really worked at this clinic where it was a session by session. There was no plan. The patients would kind of come in and I would just sort of go, well, look, is it okay if we see you next week? That would be kind of how I would communicate with the patient. And that was just all I knew. You know, I didn't know how to do it any different. And then as I matured, clearly age hasn't been kind. As you can see on that picture on the right, I moved on to another clinic where my boss said to me, look, you've got to give a treatment plan to every patient. Every single patient, you've got to give a treatment plan. And in my head, I was thinking, is this some sort of business strategy? You know, is this a legitimate clinical and evidence-based thing I can do. And then I started going through specialist training, and the more I looked into it, I found evidence-based guidelines that recommended it, research papers that recommended it, and then also all the specialist physios that I looked up to all gave treatment plans in one way or another. So I sort of transitioned from maybe being innocent into realizing that this is something that is really useful. And then my clinical outcomes drastically improved, starting to use them now with every patient. Now I've got this next slide in here. When I was actually transitioning from not having a beard to having a beard, I went to this barber in Perth and I said, look, I'm just growing this beard, and I just wanted to know if you could just have a look at it, maybe give it a trim. And he fired up and he said, a trim? You need to take your beard seriously. And I said, oh, whoa, okay. And he goes, you need to come in here every fortnight and get that beard sorted. And I was like, whoa, okay. So he basically tried to business treatment plan me about my beard. And I think it's not really, the last thing you want to do is come off as salesy or businessy when you're trying to communicate a plan. That's not it at all. But it has helped me immensely with communication, a clear outline, reducing the likelihood of cancellations. Like I'd say I would have dropped from maybe, 10 to 20% to like 1 or 2% of patients cancel now. Like I very rarely have cancellations. A really key point out of today is don't be afraid to see patients more initially to reduce their pain in that symptom relief phase. And then don't discharge them too soon. So the common lament as I give second opinions every day, is that physios have been physios underservice the patients initially and then discharge them too soon for whatever reason, for a myriad reasons. So I probably tend to see patients for longer, but then and don't discharge them too soon, but I ironically end up getting them to self-manage better. So, and the research would support that even if you see them multiple times at extrapolated time points, those patients tend to be able to self-manage better. And then obviously you get better long-term outcomes. And I've had patients will come in and go, I've just heard you do plans. And I tend to get more referrals from other patients because of that. We're actually coming up with a plan.